Hi, I'm Jen Fury, reporting for Daily Bulletin. I'm talking with Dr. Rebecca Zhang from the University of Pennsylvania in Philadelphia. Dr. Zhang is sharing some insights from the RSNA 2025 education exhibit, a case-based primer on breast imaging in transgender patients. Thank you for joining me today. How do you approach communicating breast cancer risk and screening options to transgender patients who may have limited awareness of imaging guidelines?
Yeah, so I think the first step is starting with increased education and awareness regarding screening guidelines in transgender patients. And so when I was doing this talk and doing a review of the literature, I came across the screening guidelines that exist in the American College of Radiology. And so they kind of break it down by transgender male and female patients. And so for our transgender male patients, so assigned female at birth but transition to male, it all depends on kind of their surgical history and if they have any breast tissue remaining. So, for example, if a transgender male patient has had what's commonly referred to as top surgery, it depends on if they still have any residual breast tissue. If they do, they likely had what's called a reduction mammoplasty, and screening guidelines are actually very similar to those of cisgender women. However, if they've had a bilateral mastectomy, in which case all of the breast tissue is removed, then screening mammography is typically not recommended in those cases. On the other hand, for transgender female patients, so patients who are assigned male at birth and transition to female gender, our screening guidelines depend on if they've received estrogen therapy for 5 years or greater. If they have, and patients are average risk, starting at around age 40, digital breast tomosynthesis and screening mammography may be appropriate for those patients. If patients have had estrogen therapy for 5 years or greater and they're at higher than average risk, it's actually recommended to start screening mammograms at age 25 and older.
What are the most common imaging challenges or pitfalls radiologists encounter when evaluating transgender patients post-hormone therapy or surgery?
Yeah, so I think for both transgender male and female patients, it approaching their imaging, we really have to kind of take into account their medical and surgical history. And so if they've had surgery, being aware of what the expected post-surgical changes in those cases looks like. And if they've had medical therapy or hormonal therapy, like estrogen, for example, being aware of the typical changes to the breast that occurs after estrogen therapy. So typically we see an increase in fibroglandular tissue and breast density after the use of estrogen therapy, which usually peaks around 2 to 3 years. So kind of being aware of that timeline and how long a patient's been on therapy really helps provide a framework of how we approach their imaging.
Where do you see the biggest gaps in research that could help refine screening recommendations for transgender populations?
Yeah, so our guidelines for screening in transgender patients are mostly based off our data of cisgender women, because that's where the vast majority of our data is from. So I think moving forward, hopefully, as we acquire more longitudinal data with larger cohorts of both transgender male and female patients, we can develop kind of more tailored and more accurate screening guidelines depending on breast cancer incidence in these patients.
Thank you so much for your time today. For more information about the study, look for this RSNA 2025 session on demand at rsna.org/meetingcentral. And as always, you can find more radiology news at rsna.org/bulletin.